Good afternoon, ladies and gentlemen, friends and supporters. My name is Lesley Regan and I'm the chair of the charity Wellbeing of Women. It's a real pleasure to welcome you to this, our very first webinar. And I think there's something rather sweet about this webinar and the topic, which is, and I read to you, putting your eggs in one basket, the myths and facts of social egg freezing. And why I think that I'm particularly glad to be sitting here as the new chair of Wellbeing of Women and introducing our very eminent panel is that back in 1984, when I was training as registrar in obstetrics and gynaecology, I found myself working in Cambridge. And I was working with an embryo and gamete research group attached to the Medical Research Council. And that's where I learned how to undertake IVF. Now, in 1984, it really wasn't possible to freeze eggs. And we'll hear about all that later. But what I think was very interesting for me was that I had the enormous privilege of working with Mary Warnock at that time, who was the then Mistress of Girton. And this was the time at which the HFEA or authority was being formed and the Embryo Act was going through Parliament. And it was a wonderful insight for me as a junior trainee, excited by these developments in reproductive medicine, to have this extraordinarily wonderful, brilliant philosopher talking to me on a regular basis about what she was doing. So I think it's very lovely that we've got this wonderful panel today. Now, we have four fabulous speakers, and in order of the way that they're going to appear, we have Sophia Money Coutts, who's a journalist who's undergone egg freezing in 2020. And she's presented a podcast called Freezing Time on her experience. And you won't be surprised to hear that a charity like Wellbeing of Women wants the women that we're looking after to have a really loud voice. So thank you, Sophia, for coming and also for opening proceedings today. And she's going to be followed by Lisa Webber, my colleague and reproductive medicine expert at Imperial College, who has an enormous wealth of experience in ovarian function and will be talking to us in more depth from the medical side of things. Then we're going to have Sally Cheshire, who is the chair of the HFEA, the regulatory body that I was so pleased that we have in this country, in which I think many countries in the world look to the UK and feel very envious of the fact that we have this important regulator. And last but not least, we have Baroness Deech, who is a formidable legal opinion and ethicist, and she's going to be talking about the ethical implications of storage. And I'm going to leave it there because as I introduce them all to speak, I can say a few more words about them. They all know how wonderfully eminent they are, and I want you, our audience, to have the benefit of what they're going to say, not what I'm saying to you. So without further ado, I'm going to pass over to Sophia, who is going to tell us a little bit about her experience and her reflections of what it was like to go through egg freezing. Can I remind the audience as well that we're talking here today about social egg freezing, not egg freezing for medical reasons. And I want to emphasize that because when we're talking about medical indications of egg freezing following serious or perhaps cancerous treatments which would damage the ovaries, we're talking about very, very different issues. If you're enthused by what our experts have to say, I might be able to twist their arms to come back and give an alternative or an additional webinar about medical indications. But remember that this is about the myths and the facts of social egg freezing. And with that, I'm going to hand over to Sophia. Sophia, thank you so much for coming. Thank you for being so brave and honest with us all, telling us about your experience. I loved your article in the Times the other week.
Oh, good.
And I know that you're going to be a really very engaging speaker. The floor is yours, or the screen is yours.
Wonderful. Thank you, Lesley. No pressure there. Thank you very much for that very kind introduction. I feel, yes, I feel I'm a total layperson coming at this and surrounded by four very amazing women and experts on the subject. So yes, I'm coming at this speaking about it from the point of view of someone who has just gone through social egg freezing. I did it in June and I made a podcast about it, Freezing Time. And it took me, I don't know if there will be women watching who will be thinking about this, it took me really 2 years to decide to do it. Having spoken to lots of women who have gone through it and who are also thinking about it, I think it seems to be the decision process is one of the hard bits, because deciding to do egg freezing means accepting that you as a woman in your 30s are not perhaps where you might have thought you would be in your life. And it can feel very difficult when all around you're going to weddings all the time and everyone's having babies, and you think, oh, what's wrong with me? Why can't I find anyone to marry and have babies with? So for me, the process, the journey, I joke on the podcast that it's really difficult to talk about any sort of fertility topic without talking about your journey in a cod American accent. But mine started just over 2 years ago, when I took a friend of mine into hospital to have her eggs frozen. And the reason she'd asked me is that she hadn't told really anyone that she was having it done. I was 33 at the time, she's the same age, she was 33. She was very proactive and decided this was a good thing to do. She'd been single for a long time, but she felt really ashamed about it and hadn't told even her parents. So she said to me, Soph, do you mind taking me into hospital and on her collection day, and taking her home again? And I was sort of delighted to help in any way I could, but I felt very sad about this at the same time, because I thought how awful that she's doing this incredibly brave, proactive, independent thing as one of my most successful friends who can afford to put herself through this. And I'm sure we'll get onto the money side of things in a bit. But she felt sort of slightly embarrassed, and she didn't want to tell anyone or sort of admit, quote unquote, that she was doing this. So I took her in. I was the worst nurse ever. I was the worst Florence Nightingale, because about a month before I'd broken up with my then boyfriend. So I hadn't basically stopped crying for about a month, and it was even more emotional, taking someone in for egg freezing, having just broken up and thinking, well, God, should I be doing this? And so it sort of forced me to confront where I was in my life as well. But then, like I said, it took me about a year to then pluck up the courage to have a fertility test, which is kind of the first stage really that you will go through if you think about doing this. It's a blood test and a scan to check your hormone levels and how your ovaries are looking, really. So I did that about a year later. I was terrified about the results. There's this whole debate: do you want to do it? Do you not want to do it? Is it better to know? But my results were pretty average, so that was fine. And then really it got to the beginning of this year, and I turned 35 in February, and I thought, well, as a sort of 35th birthday present to myself, I'm going to give myself a round of egg freezing. So it was really, that 2-year process it took to decide to actually do it. And then once I decided, that was kind of, then you want to get on with it, right? Because then you decided you're not getting any younger. You sort of feel like every month that goes past, it's a bit of a waste. You may as well do it while you're as young as you can. The average age, the typical British woman is 38 when she has it done. So I was a bit younger, being 35, but really the earlier you can sort of have it done, the better. So I decided to do it, started the drugs. Lockdown happens, so I had to come off the drugs again in March. But then as soon as the government gave the okay to clinics again, I jumped back on the nasal spray first. So that was for 2 weeks. I took a nasal spray that puts you into sort of early menopause. Lisa will probably talk about this in more detail. It stops your brain basically talking to your ovaries. And then 2 weeks after that, I started the injection of the hormone that increases egg production, basically. And really from start to finish, it was a month. From the first hormone to my operation, it was a month. There were incredible highs and lows. I actually felt quite good towards the end of the process, because I think I was so full of estrogen, it made me feel quite perky. And then I had the operation and I got way more eggs. I thought I'd get around 10, 11, 12 eggs. I was incredibly lucky, and I actually got 22. I think like I said, I'm 35, so I'm a little bit younger. I seem to respond quite well to the drugs. That was my first round. My doctor said subsequently, different rounds, you can react very differently. So I think I basically got very lucky. I actually felt worse. The worst bit of the whole process, I have to say, was immediately afterwards. I think because I got so many eggs, I blew up like the Michelin Man. And I took anti-ovarian hyperstimulation syndrome drugs, but I felt really quite grim for about a week afterwards. So I've said to lots of women who have asked me or got in touch, don't expect, you go on the forums. Of course, we shouldn't go on the forums, but we all go on the forums and we all Google these things. And a lot of women say, oh, I felt totally all right, and I skipped back to work the next day. I was not skipping anywhere. I basically lay on my mum's sofa for about a week, feeling really quite grim. So that was the worst bit, really. I mean, I felt very up and down for the month I was taking the drugs, but it wasn't too bad. It was sort of like very bad PMT, and I had in my mind that this was, a good proactive thing to be doing. So I just tried to remember that at all times. So yes, overall, I feel hugely, hugely lucky that I that I got so many eggs, I think I'd probably feel less positive about the process. You know, if you're a woman who gets one or no eggs, I can't imagine how difficult that would be. On top of the expense, it cost me nearly £5,000 for the whole treatment plus the drugs. Remember, the figures quoted by the clinics probably won't be the figures that you also have to add blood tests and drugs on top of that. So one round for me ended up at about £5,000. So yeah, I think I worked out as £205 per egg. So very expensive eggs. But I'm very glad and feel really relaxed. I mean, now that I've done it, I'd had friends who'd gone through it, and I had expected my shoulders to drop a bit, but the feeling that I had, even knowing that, the feeling of relief that I had and still have afterwards has been pretty immense. So I'm very worried. Since doing the podcast, I say on the podcast, I don't want to sound like I have a sort of savior complex, or I don't want to be pushing egg freezing on anyone, obviously, because it's a huge decision. Emotionally, physically, financially, but in my case I feel very lucky that it's worked out. And again, no insurance, no guarantee of a baby, but I just do feel like it's given me this breathing space and made me feel sort of happier about where I am in life.
Thank you, Sophia. And you very generously shared with us the costs, about £5,000 that you
yeah, it varies. The drug costs vary, but yeah, that was for me.
Exactly. And I just need to remind our audience that that's just the beginning, because of course there will then be a charge for storing your gametes, an annual charge. And then you'll hear later from Ruth Deech about the worries about how long can we store them for. And then remember that you're going to have a thaw cycle and a transfer. So that's going to be another significant chunk of money too. So I'm not going to preempt those potential questions from our audience, but I'm going to move on to Lisa Webber now, who's a medical expert in the field of ovarian function, and she's going to share with us a more in-depth look at what egg freezing is, including an overview of the medical procedure and what actually happens, and also talk a bit about the decision making. So Lisa, over to you, please. I think Lisa's going to share some slides with us now. So
yeah, and I hope you can see my slides now.
Not yet.
Oh dear, this all worked in rehearsal. Let me try once more. I'm afraid I've just got an error message, which is saying that screen sharing has failed, which is very irritating. And you still can't see it.
Okay, so
I may have to log off and log on, because I don't know why this has failed. It worked in dress rehearsal.
So Lena, have you got the slides there too that you could put up?
Let me try once more. I'm just going to try and reshare my screen.
There we are. This has looked much more hopeful. Yes, we're there. Thank you. We're there.
Perfect. Okay, sorry about that. So, Sophia, may I just say thank you very much for sharing your story. I found myself actually feeling quite emotional when you were talking about the experience of your friend who actually felt ashamed. Isn't it horrific that as women, we might be left feeling in that position? And I'm delighted that you obviously don't feel ashamed and that you've had the bravery to share your story. So what I'm going to do is start by just sort of putting all of this in context. Why do we think about egg freezing? And the reason we think about egg freezing is really because of the effect of age on reproduction. And what I'm showing you here, the graph on the left-hand side of the screen, shows the annual fertility rate per 100 women who are not using contraception. And this graph is based on 10 different populations, what you might consider to be traditional populations, where a lifestyle choice is never to use contraception. And I have to give thanks to NICE, the National Institute for Clinical Excellence, who have made these graphs available in their clinical guideline CG 156. And what this graph really shows is the big impact of age on the chance of reproduction. What I've shown you on the right-hand side of the slide is the live birth rates with IVF. And the thing that's quite striking, of course, is that the shape of the curve is exactly the same. So just to recap, on the left, we've got natural conceptions, according to age, and on the right, we've got the impact of IVF. Now, the reason I'm sharing this particular slide about IVF live birth rates, which is actually from quite old data now, these are data from 2007 and 2009, and they've come from the HFEA, is that it shows actually what the chance of success is. It's breaking it down by age under the age of 35, because the way that we now report the data, the way the HFEA report the data, is all women under the age of 35 are grouped together. And the reason for that is because the top of the curve is really quite flat. So the difference in live birth rate when you're using IVF between the age of, say, 24 or 25 is actually not significantly different from at the age of 34. And if just to put it in perspective of where are we now, 12, 13 years on from when these data were collected, or when these treatment cycles were done, is the top of the curve on the chart that I'm showing you is around about a 37% live birth rate with one embryo transfer, and the latest data from 2017 pushes that graph up by about 5%. So it's now about 41% live birth rate per embryo transfer cycle. So that's the background to why we're having this conversation today. Now, what I'm going to talk you through are, I'm going to spend the first half of my talk on what egg freezing involves, including the risks. And then the second half of my talk is I'm going to try and take you through what the chances are of a live birth. And included in that, I'm going to try and have a bit of a brief discussion about how many eggs do you need. And then I'm going to try, if we have time, to sort of maybe have a little bit of a chat about what might be the optimum age to freeze eggs, if there is indeed such a time. Now, as Sophia's alluded to, there's a couple of tests you have to have done before you start. The first is a blood test. It's usually for the hormone anti-Müllerian hormone, AMH, and this is produced by small growing follicles. The follicle is the structure that contains the egg. You'll also have a blood test for the hormone follicle stimulating hormone and estrogen, and that's taken on day 2 to 4 of the cycle. And then you'll also have a pelvic ultrasound scan, and that will usually be done through the vagina. And this is what you're going to see on that ultrasound scan, is you're going to see an ovary. And what you can see in that picture of the ovary is I've put an arrow to where the vaginal wall is. So what you can imagine here is the ultrasound probe. It's in the vagina, it's pressing against the top of the vagina, and the ovary is lying right next to that ultrasound probe. At least that's what you're hoping you're going to be able to see. And then the black holes within that ovary are the antral follicles, and your doctor will do what's called an antral follicle count. And so between the antral follicle count, your AMH, your FSH, and your estrogen, that's a way of assessing what's called the ovarian reserve, or what's sometimes called your egg number, and that's used to plan your dose of stimulation. You may also be asked to have a urine or a swab for chlamydia, but you will definitely need to have blood tests for hepatitis B surface antigen, hepatitis B core antibody, hepatitis C, and HIV 1 and 2. And that's mandatory. All patients who wish to undergo this procedure need to have those done. Now, this is a timeline of egg freezing, and as Sophia's experience is, she was given what's called downregulation. That was the nasal spray that she was talking about, but it might be that your clinic will just get you to take some progesterone tablets. So that's your downregulation cycle. So that's going to be approximately a month, because the medication that you're taking will make it be approximately 4 weeks. And then the next step is when your next period occurs. This is the beginning of the stimulation cycle, and it will always start with an ultrasound scan, and that's really just a final check. Is everything okay? And that's when you will start the daily injections. On average, the injections will last for 9 or 10 days, and the last injection will be a trigger injection to make the eggs ready to be ovulated, and before they can be released, you'll have the egg collection, which is 2 days after the trigger injection. So the stimulation part of the cycle lasts for 2 weeks. And then the next period will come approximately 10 days to 2 weeks after egg collection, but depending on the protocol you're on, it might actually be considerably quicker than that. It might, with some protocols, it will come more like about a week afterwards. So if we're counting it from the beginning of the downregulation cycle until the day of egg collection, it's about a 6-week process, but the actual cycle of egg freezing, the stimulation, is only 2 weeks. And this is what it looks like. This is what's actually happening inside. So your ovary is going to go from that one that I'm showing you on the left-hand side to this big chunky ovary. The scales are about the same. So this is a realistic impression of how big the ovary gets. And you can see those little black holes have now all become big. And these are the mature follicles. And what you can't see on this, what you can't see on ultrasound are the eggs themselves, because they are microscopic. The egg, by the way, is the largest single cell in the human body. So that's what it looks like on the day of your egg collection. And then this is how an egg collection is actually done. So the ultrasound probe will go into the vagina. You will, by the way, be asleep at this point. And then the blue line on that illustration, which I'm just going to highlight here, this illustrates where the needle goes. Now, the ovary isn't this far away from the vagina. In fact, the ovary is right next to the vagina, as I've shown you before. And this little white line here is the egg, which is, which is the needle going into the follicle. And what your doctor will be doing is sucking out all of that fluid, and along with the fluid will come the egg. Now, what happens with those eggs is they come out and they're surrounded by a whole load of little tiny cells, which are called cumulus cells. They're the supporting cells. They will get stripped away by the embryologist, and you will then be left with the egg. The eggs will then be examined, and those that are looking healthy, there's no test that's done on the eggs, I think that's very important to understand, will then be frozen. And in the 21st century, all eggs will be frozen by a technique called vitrification. And what that means is basically it's an ultra fast freezing. And my only point about mentioning that is that I will come back to later the old fashioned way of freezing eggs, which was very unsuccessful, and that was called slow freezing. What will then happen at some point in the future, you may or you may not return to use the eggs. Actually, at the moment, we believe that only about 12% of women will return to use their eggs. But when you come to use it, those eggs will be warmed. They will be taken out the freezer. Technically, they're not thawed, they're warmed. And then they will need to be injected with a sperm for fertilization, and then embryos will hopefully develop from those fertilized eggs, and you can then undergo an embryo transfer cycle, during which 1, 2, or 3 embryos, depending on the age at which you were when those eggs were stored, will be transferred into the womb. Now, there may or may not be any so-called spare embryos, which can then be frozen for further bites of that same cherry. And I'm going to talk you through success rates in terms of one embryo transfer cycle, as well as what's called a cumulative live birth rate, which depends on how many embryos you've actually got from the whole cycle. So moving on to the risks of the procedure. Well, Sophia's actually told us about one of the risks, and that's ovarian hyperstimulation syndrome, OHSS. And she's described what happens, but from the medical viewpoint, the thing that actually worries us is that it can cause an upset in the function of the liver, the kidneys, and most importantly, the clotting mechanism of the blood. Because the clotting mechanism of the blood, if that's upset, can put you at an increased risk of having a blood clot. Now, thankfully, these are very, very rare events, but they can be fatal. Now, the aim of the exercise is to keep the risk of OHSS to an absolute minimum, and there are protocols which are used in a lot of clinics which are considered to keep the risk of OHSS to be way less than 2%. It may be higher with some protocols. Another risk is that of the surgical risks of egg collection. I was rather pleased to hear Sophia mention to it as an operation, because it is an operation, it's a surgical procedure, and surgical procedures have risks, and the risks are of introducing infection, causing internal bleeding or hemorrhage, or injury to any of the organs in the vicinity, and that's typically puncture of the bladder, the bowels, and I've even heard of ureters being damaged. They're the tubes that go from the kidneys to the bladder. But other risks include things like having no mature eggs collected, and that can be because you've ovulated earlier than was anticipated. That's not a common occurrence. It could be that only immature eggs are collected. Again, not a common occurrence, but it can happen. Or it could be that the eggs are of such poor quality that basically they disintegrate on retrieval, and there's nothing to put into the freezer. There is the psychological impact, and I thought it was very brave of Sophia to talk about how it makes you really consider, why are you doing this? And then, of course, there is the fact that you might do all of this, you might spend all of the money on it, and the eggs that you have collected might not actually yield you that baby. So what I'm going to move on now is just to spend a few minutes talking about the chance of a live birth from egg freezing. Now, the Human Fertilisation and Embryology Authority not only are our regulator, but they collect a fantastic amount of data, and they really do provide us as professionals and also women and their supporters and partners with some fantastic information. And the HFEA did a deep dive into the data that they have, and that's been published and it's available on the HFEA website, and it's called Egg Freezing in Fertility Treatment. And what this did was it's a piece of work that's looked at the outcome of egg freezing in the years of 2010 to 2016. And what I'm going to show you is the data that they came up with for women who were undergoing egg thaw cycles in 2016. Now, there were 178 own egg thaw cycles. So this is not talking about women who frozen eggs for egg donation. This is women who are freezing eggs for their own use. So that's a relatively small number that we're talking about. And because it's a small number, the most appropriate number that the HFEA came up with when they were talking about this was to actually put all of the women who were thawing their eggs into one basket, into one age group. And so the overall live birth rate per thaw cycle was 18%. Now, what's meant by a thaw cycle? That's when all the eggs have been taken out of the freezer and the eggs that have been taken out have been fertilized. And this is looking at the chance of having a live birth per one embryo transferred cycle. And that the number of embryos that could be transferred could be 1, 2, or 3. Now, a piece of important information when looking at these data is to actually understand something about the age at which the woman was when she froze her eggs. And in this cohort of 178 egg thaw cycles, 60% of the women were over the age of 35, and actually 20% of them were actually of 40 or over. So when we're looking at these data, this 18% figure probably applies to you if you're actually of the average age that women were when they thawed when they froze their eggs, and that's around about the age of 38. But it's an underestimation if you were under the age of 35, and it's an overestimation if you are over the age of 38. Now, what are some of the other factors that might influence the overall chance of success? Well, because these data were based on egg thaw cycles that were done in 2016, we know that at the moment it looks like women keep eggs in the freezer on average for about 2 years. It is possible that some of these data included eggs that had been slow frozen the old-fashioned way, and that might actually be slightly lowering the what it looks like the live birth rates. It may also reflect some of the inexperience of clinics in this procedure of egg freezing. It's quite surprising. Well, maybe you won't be surprised. I was quite surprised when I realised that actually in 2010 there were only about, I think it was about 35 or 37 clinics in England that were offering egg freezing, and in 2016 that had gone up to 64 clinics. And actually, of those 62 or 64 clinics, only 3 clinics had actually done more than 100 cycles a year, and only about 20% had done more than 10 cycles in a year. And then there are population factors. We don't actually know very much about these women who froze their eggs. About 10% of them were freezing them for medical reasons. And actually, when that 10% were looked at separately, the chance of having a live birth was actually exceptionally low. It was actually around about the 8% mark. But there may also be something different about women who are freezing eggs for their own use compared to women, for example, who are undergoing fertility treatment, or indeed those who are egg donors. And just by way of a comparator, what I've put on the bottom of this slide is that in the same year, in 2016, the overall live birth rate for women who are having IVF or the standard delayed conception indication was 26%. But those women were generally younger than those who were thawing their eggs. The average age was around about 35. And if we compare it to those who were undergoing thawed egg donation, there was a higher chance of a live birth, and that's 30%. But what must be remembered about egg donors is that they have been selected for their reproductive potential. So they are not the same as women who are undergoing IVF for fertility reasons, and they're probably not the same as women who are undergoing egg freezing for their own use. So what do we know about the effect of the actual freezing process? And I'm talking here about the modern vitrification process, which is now what's going to be done by all clinics. What do we know about the impact of that on live birth rates? So what I'm showing you here are data just about donor eggs. So these are women who have been assessed and have considered to be the best possible reproductive potentials. And if we look at the chance of success in 2016 of women who were receiving donor eggs fresh, so these are eggs that have not been frozen, the chance of a live birth was 33% per fresh embryo transfer. So that's putting 1 or 2 embryos back. And the chance of success from eggs that have been frozen is actually very similar. It's about 30%, and that's very reassuring. And if you look at the international data that we've got that has been published in peer-reviewed literature, is you find similar figures, is that the chance of success with eggs that have been frozen when they've come from a donor who should be under the age of 35, fit and healthy, is the chance of success is very similar to when those eggs have been used fresh. And that's very reassuring. But there are some data which have come from America, and these have come from the SART, which is the Society for Assisted Reproduction and Technology. What those data have shown, which is retrospective, so they've gone back to the records and have a look at them, but there was about 100,000 cycles, is that women who used frozen eggs may have had up to a 19% lower live birth rate compared to those who used fresh eggs. But there's quite a lot of ifs, buts and maybes that go into that data, because actually the number of eggs that were available to the women who were using frozen eggs was smaller. And what I'm going to talk to you about before I finish is the impact of the number of eggs that are available to you, because it's egg number and egg quality that actually impacts on live birth rates. So let's talk about some absolute numbers to try and put this into sort of something that we can all get our head around. So what I'm showing you here are the chances of a live birth rate, a live birth per treatment cycle. So this is per cycle started. And what you've got on the top line is these are data that have come from the HFEA. You can look at them yourself. They're available on the website per treatment cycle. And I've lumped together, just to make it statistically more powerful, I've tried to put all women who are having both IVF and ICSI. So that's where the eggs have been injected with sperm. And this was women undergoing treatment in 2017. And I've shown it broken down by age at which they were having treatment. And what you can see here is the impact of age, which is what I started off talking to you about. So the best prognosis group had a 34% chance of a live birth. What I've put in the second line is this is an estimated live birth per hypothetical thaw cycle. So this is if you're sitting, as we are today, thinking about, I might consider doing egg freezing. What are my chances when I take my eggs out of the freezer and I have the first embryo transferred? And what I've done is I've reduced the live birth rates from the fresh cycle by 19%. And what you can see here is an estimation. And I think that this is probably a reasonable way of modelling it, because if we look at our 38 to 39-year-old age group, what you can see is we've come up with that magic figure of 18%. Now, if I now show you this, is because what I mentioned earlier is that how many eggs do you need and what is the impact of the number of eggs that have been collected? Now, in 2016, the average number of eggs that were collected in a thaw cycle, bearing in mind that the average age of women who are, average number of eggs who've been collected in a freeze cycle, the average age is 38. And the average number of eggs that's collected was 10. But the average number of eggs that got put into the freezer was 8, because we expect about an 80% drop. So that extra 20% of eggs, or per individual patient, those extra 2 eggs are ones that are going to be atretic, the eggs don't look healthy, or they've disintegrated, or they were immature. And what you can see in the bar chart below is the number of eggs that were collected by age. And if we look at the youngest age group, no surprises there, they've got the highest number, and the actual number is just over 12, 12.2. But if you look at the oldest age group, those women who are over 44, the average number of eggs that was collected is actually just under 4. Now, 4 eggs is actually quite a critical number of eggs in IVF terms, because there are data to suggest that it doesn't matter at what age, but if you have fewer than 3 eggs collected, then your live birth rate overall, regardless of age, is going to be under 5%. Now, the other important piece of information that you need to understand about when you freeze eggs is that not every egg that goes into the freezer is going to survive the freeze-thaw process. And it's estimated that in a clinical practice, and we're not talking about in research, where you always get better results in research, but in clinical practice, probably around about 70 to 80% of eggs will survive the freeze-thaw process. But what's important also to understand is that actually the proportion of eggs that survive the freeze-thaw process is lower in older women, so those who are over the age of 36. So what this means is that if we have a look at the number of eggs collected, if a woman has 10 eggs collected, so this allows for the fact that they've got to go into the freezer and come out of the freezer. If she's under 35 and she's got 10 eggs collected, she has a 60 to 70% chance of having a baby when all of the embryos have been used. And that falls to 30% in women who are over the age of 36. And if we have a model that's based on 20 eggs collected in total, that will be from more than one cycle, is if she's under 35 and she's got 20 eggs collected, that will give her about an 80 to 90% chance of a live birth. And that number will fall down to about a 30 to 40% chance in the woman who is 42 when she freezes her eggs. And the number that I've put at the bottom is the average number of eggs that are collected each collection. So
we're going to have to wind up very soon because we've got to get the other two speakers.
Sure. I'm just going to finish with this, my last slide, which is to show that the average 38-year-old woman, which is the average age of a woman who is freezing her eggs, would need 40 eggs to be collected for an 80 to 90% chance of a baby. And that will take her 3 or 4 egg collections, several embryo transfers at an estimated total cost of £25,000 to £30,000. If she has one cycle for an estimated 40% chance at an estimated total cost of £10,000 to £15,000. Thank you, and I apologise for running over.
Okay, thank you very much, Lisa. Now I'm going to ask Sally Cheshire, who's chair of the HFEA, to speak to us now. She's going to talk about checks and balances and some other aspects of decision making. I could give you a very long and elevated CV, but I'm not going to because I want to hear what Sally's got to say. So Sally, over to you, please.
Thank you very much, Lesley. Can everyone see my screen and can you hear me?
Yes, thank you to both.
Excellent. So thank you for asking me to speak today. There we go. The HFEA, as Lesley very kindly said at the start, has been around for about 30 years. In fact, it was 30 years since the law was passed last weekend. And we regulate all of the clinics and all of the treatment in the UK, as well as embryo research. There are currently 106 UK clinics providing treatment, with around 40% of those in London and the South East. The HFEA keeps a register of every cycle of IVF treatment that's happened since 1991, and we have the biggest database of fertility treatment in the world with more than 1.1 million cycles. I will quote some data during this short speech. I know Lisa's touched on those as well. There may be slight discrepancies between 2016, 17 and 18 data, but mine all correspond with what Lisa has said. As the regulator then, we set standards of care and treatment. We aim to provide everybody who steps into a clinic with independent factual information about their particular treatment and what is going to happen to them, their chances of success, and what is involved. And we also contribute to the wider legal and ethical debate as society and science changes and advances. On egg freezing in particular, we ensure that that treatment is ethical and appropriate, and that you, if you're going to undergo such a procedure, receive impartial information to make the best decision for you. And the point of my talk really is about making the best decision for you. I think Sophia talked about how she took 2 years to make her decision, and she's made what she feels is the right decision for her. For some women it is, for some women it isn't. And I would encourage you, as everybody has said so far, thank you so much for mentioning the HFEA website and looking for information. So egg freezing is becoming more popular, but the numbers are still relatively small compared to overall IVF treatment. Around 2% of cycles, around 75,000 cycles a year, around 2% of them are either freeze or thaw. So it's wise to be cautious about all of the numbers that we quote because they are still small. But due to the growing interest in egg freezing, and this increase since 1999 every year, we produced the report that Lisa referred to previously. There are now around 2,000 egg freezing cycles a year Our latest data is from 2018, so slightly later than Lisa's statistics. I think it's important to say that at the time of freezing, around half of women had a partner and half didn't. The most common age to freeze was 35 to 37, then 38 to 39, with the average, as Lisa said, being 38. I would really worry if you were going to a clinic who said that approaching 40 would be a good time to freeze your eggs. And you need to be really careful, bearing in mind what Lisa and I am going to say about the decline in reproductive success as you age. Most women wanting to thaw and use their eggs when they came back were over 40. Bearing in mind it's the age at which you freeze that is the most important. And by that stage, around 500 cycles in 2018, 90% of those women then had a partner. But some of them still didn't and chose to go it alone as single women. The success rate using your own frozen eggs, one of the statistics Lisa referred to, we think is 18%, and we know is 18% per treatment cycle. But that includes women who've frozen for medical reasons. And it is below the rate of fresh IVF at 23% overall. Although if you remember the graphs at the start, the overall success rate for under 35s is around 1 in 3. And as Lisa also said, the success rate using frozen donor eggs, because those donors are normally under 35, is higher. What I really want to stress is that this isn't an insurance policy. And it really annoys me when media headlines start to say it is an insurance policy and it will get you over the line at some point in the future. I think Sophia's been really honest about her age, the process she went through, the acknowledgement that it may not actually give her a baby at the end of the day, but she's pleased with the decision she's made so far. Your decision depends on many factors, and it's definitely a personal one that may or may not be right for you. The key success factor, as we've said, is your age at freezing. Cost is also important because whilst NHS funding is normally provided for women who are undergoing medical freezing, of whom 90% are under 38, NHS funding is not provided for elective reasons for social egg freezing. We estimate the cost of a cycle, as we've talked about already, to be between £7,000 and £8,000, around £3,500, but can be up to £5,000 for your egg collection, around another £2,000 to £2,500 for your fertilisation and embryo transfer, plus storage costs and drugs. You will need to weigh the medical risks that have been highlighted today, and actually the chance that you may never need to use your frozen eggs because you may well conceive naturally later in life, with the chances of success that you might have. 62 clinics offered freezing in 2018, but only 3 performed more than 100 cycles. That number is now 5 clinics who've performed more than 100 cycles, and they're all in London, probably all competing with each other. The other thing that I wanted to say, just to introduce Ruth really, is to say that women who have a diagnosis of medical infertility are currently allowed to store their eggs for 55 years. Those regulations came in 2009, and that really was designed to allow, for example, teenage girls who might be undergoing cancer treatment and storing their eggs to reach the end of their reproductive life and still be able to use their frozen eggs. For non-medical reasons, this is currently 10 years. It has been extended to 12 years during the pandemic for those women who were coming to the end of their 10-year period and couldn't have treatment whilst clinics were closed, but that's a temporary regulation. We support the government's consultation that's happened recently, which will propose to end the anomaly and extend the 10-year limit, as long as certain steps were in place for practical reasons for women and for clinics to be able to consent every 10 years, potentially undergo counselling, and just remain in contact with the clinic, because you have to remember you would be paying for storage. So my main point is that it's not an insurance policy. It's a decision with many things that you need to weigh up and decide whether it's right for you. But I appreciate the chance to be able to talk today, and thank you for asking me.
Thank you, Sally. That's very, very helpful and very clear. And now I pass on to Baroness Ruth Deech, who in June 2019 introduced the storage period for gametes bill. She's particularly well versed, I think, to do so because, of course, she chaired the HFEA from 1994 to 2002. So Ruth, thank you very much indeed.
Thank you. I want to pick up where Sally left off with the 10-year limit. Now, I believe that every patient should be treated as an individual. They've all got their own life stories. They shouldn't be treated as statistics. We should have compassion for them. We should promote healing and equality. Now, because of that, I've campaigned for several years now on behalf of a small but obviously growing group of women who froze their eggs, who regard that procedure as a lifeline when they fear their natural fertility is diminishing, but they haven't found the right partner. Now, typically, such women freeze their eggs in their early or mid-30s, as we've heard. And the law is that they can only be kept in storage for 10 years, whereas men can usually store their sperm for 55 years. And don't start me off on the inequality of the sexes in this particular regard. There's an awful lot to be said about that. Now, the women who've frozen their eggs, when they reach their early 40s, and they might well be thinking that's the last possible chance of natural conception, they will find that because the eggs have been stored for 10 years, that they've got to destroy these perfectly viable eggs. There never was a logical reason for setting the 10-year limit. It was set before modern techniques of freezing were known, and it was set really for cancer patients who were having treatment, and it was thought that they'd have their treatment and within 10 years they'd either use them or perhaps they might even be too ill. Social egg freezing came later. Now, the cost of egg removal could be, as Sophia said, about 5,000. But then, and this is really important, the woman has to pay whatever the clinic asks annually for storage. If they ask you for £100 in the first year, they can ask you for 200 in the next and 300 in the next. And you are in the position of being blackmailed, because if you don't pay it, they will destroy your eggs. This is terribly unfair. It's exorbitant. And I wish someone could do something about it. At the end of this expensive journey, 10 years go by, the eggs will have to be destroyed with nothing to show for them, a sort of mini death of potential babies for the woman and a psychological blow. Litigation based on human rights law has been considered, but it's expensive, and I think the women involved couldn't afford it. That's another story. If women could store their eggs for longer, they might choose to do this in their 20s or at a time that suits them. And they wouldn't have to resort to egg donors because they froze them later, with all the added complications attached to that, just because the 10 years is up. It is now about 10 years since the practice of social egg freezing took off. So there'll be lots of women finding their 10 years are up now and very soon. And that number will increase as the years go by. COVID has led the Department of Health to give people who still have their eggs in storage another couple of years to deal with the pause. I mean, he said freeze and treatments, but that crisis is still with us. Now, all that it would take to extend the period of storage from 10 years to longer is to change the legal regulations to allow for more exceptions to the general 10-year rule. The law is a bit complicated and I won't bore you with it, but it is possible at the moment to extend 10 years if a woman is likely to become prematurely infertile. But that's fairly rare, whereas with men, they just get this automatic 55 years. So that is really problematic, and it is discriminatory against women. It's 10 years and that's it. So with the backing of an online campaign, I put forward a private member's bill in the House of Lords, asking the Department of Health to carry out a consultation and suggesting that they fix a longer period or provide, for example, that a doctor could give a certificate allowing the woman to keep her eggs longer if she has not yet, in her view, completed her family. There's very little chance that a private member's bill ever gets enacted in the House of Lords, but we have been fortunate. The request to lengthen storage was backed by the Royal College of Gynaecologists, Progress Educational Trust, the British Fertility Society, really the whole profession. The minister then, Nicola Blackwood, was persuaded that this was a good thing, and the department opened their consultation earlier this year, and it concluded in May. I'm disappointed that the government's response won't be forthcoming until early next year, and a change in the law, if recommended, could take even longer. That could take another year, in circumstances where, for women, every month counts. I'm very sorry about that dragging on, but I suppose they're understandably busy with COVID. I'm not entirely confident that the department will accept the case for a period longer than 10 years, as the consultation paper hinted at obstacles such as a shorter period or lack of room to store more embryos, or even there was a suggestion after all this time there might be too many older women becoming mothers, too many older mothers. Never mind the wrinkly old age pop stars, singers, men about to become fathers. We keep reading about them. They're 75, they're going to become fathers of their 7th child with a 5th woman. And everyone kind of says, oh, good on you. But when it comes to a few more older mothers, there's a sort of backlash. Now, the change wouldn't cost anything. It would bring profound and beneficial improvements to the way women lead their lives. The pressure to think about parenthood every time they meet a new man would be lifted. It would give women the same ability as men to balance career aspirations and family building. I'm calling on the government to make a gesture of kindness in these troubled times. It would be so welcome. It wouldn't cost them anything. And I urge all of you who are listening to write to your MP or write to the Department of Health, the Minister, Lord Bethel, ask them to do the right thing, to do the kind thing that won't cost anything, that will help innumerable women come to terms with their situation in life.
Ruth, thank you very much indeed. And to everybody in the audience, please heed what Ruth was saying. She wants you to write 2 letters, one to your MP and one to Lord Bethel. And if you've got energy after that, please also write to the Department of Health and ask them to be kind and compassionate. And perhaps this could be another carpe COVID moment where COVID does something good for women's health. Now, thank you to all of our speakers. I think that you will feel, audience, that we've got a wealth of talent here. We've had lots and lots of questions. I'm not going to be able to address them all in the short time we have left. I do promise you, though, that the WOW team will respond to all of your questions, and we'll be sending them out in the chat and saving them all and responding to you if you've identified yourself and given us a contact. So we will deal with that. Now, there have been quite a few questions. Somebody recently was saying to me she froze her eggs in Spain because of this 10-year cap. And Ruth has explained very clearly, if you like, the anomaly of why there is a 10-year rule. But we've also had several other questions. Are there other EU countries which allow social egg freezing? Ruth, would you like to answer that question?
Yes, I think there are. In fact, there's a whole variety of regulations across Europe, some more liberal, some less liberal. Some countries allow you to do things that we would not regard as ethical, but I'm pretty sure there'll be egg freezing across Europe. I suspect not in Italy. Italy went very conservative, and I suspect not in Poland, but certainly in Northern Europe, France, Belgium, Scandinavia, and so on, you'll find pretty liberal laws like ours.
Thank you. And there's a question here also from Janet that was pre-submitted. Is there an age cutoff when eggs can be frozen? I.e., is there a point at which they can no longer be frozen? Lisa, would you like to just give us a yes or no to that and an age?
There is no, the cutoff is when there are no eggs to collect. That's the absolute cutoff. I've shown you some data for women who are over the age of 44. One could argue, and I think this is in the, beauty is in the eye of the beholder, is that whether it is sensible or not to be freezing eggs when you've only going to have a 1% chance of there being a live birth is very debatable, because actually your risk, the risk rate probably exceeds the potential benefit, i.e. that of having a live birth.
Thank you. And I'm going to pose this question to Sally, which is about nutrition, and quite a lot of questions about hearing about people being recommended high protein diets but is there any evidence behind this advice? Sally, over to you.
I think the important thing is to suggest that everybody should be eating as healthily as they can, giving up alcohol, tobacco, recreational drugs, but there's no evidence that a particular diet or vitamin supplements that can often be sold to you at extortionate cost are actually effective. You need to just look after yourself and be as healthy as you can.
And on that point about vitamin supplements, can I just implore everyone to remember that what you buy in Boots is just as good as what you buy at vast expense in those very posh bottles. So just buy your vitamin supplements from Boots if you want to do that.
Absolutely.
Now there's a question from our audience, from an anonymous attendee, to Sophia, if I may ask you. I'm interested to know if Sophia has set herself a set of circumstances as to when and how she would use her eggs. For example, if she hasn't met someone and had a baby naturally by the time she's 40, or does she have a cutoff? So Sophia, over to you, if you wouldn't mind answering that.
No, I don't mind at all. I sort of change my mind kind of every day about this. I feel quite lucky, you know, as I said, I'm 35. I don't actually, you know I have girlfriends whose biological clock has kicked in years ago, and they have that real yearning to have a baby, and they see babies in the street, and they sort of, you know, coo and feel their ovaries sort of squeal. I don't have that. I don't feel like my biological clock has kicked in. I froze my eggs because I knew that I was approaching 35 and I could do it, and it seemed like a good thing to do. I mean, you know, I'm still very much on the fence about this. I'm trying to weigh up whether I would approach sort of thinking about single motherhood, whether I'm brave enough to do that. I don't know. I'm lucky, my family incredibly liberal and supportive, so they're all for it. My stepmother is constantly imploring me to go on sperm bank websites and find a donor. So I'm sort of mulling everything over. I guess what egg freezing has allowed me to do is to buy time, and again, that has to be prefaced with the fact that everybody's mentioned, which is it's no insurance policy, it's no guarantee of a baby. So it buys me time without necessarily a payout of a baby at the end of that. I honestly, I don't know, to be honest. I mean, it's quite hard to plan beyond. It's quite hard to plan beyond tomorrow at the moment, isn't it? And I babysat my sister's dog the other day, and that was long enough for 2 days. So I haven't decided yet. It's basically, I just feel like it's bought me a bit of time.
Okay, thank you. And just for everyone's benefit, Cyrielle, who mentioned that she'd frozen her eggs in Spain to get around the 10-year, then has shared with us on the chat that she was charged €3,000, all included, with 4 years storage and then €150 per additional year until she's aged 52. And also comments that social freezing of eggs is not allowed by the law in France, and she's French, so that's why she's aware of that. Thank you for that contribution, Cyrielle. Now, you mentioned about sperm banks, and one of the other questions from Evgeny Ufit is the live birth statistic affected by the quality of the sperm used in fertilization? Lisa, would you like to address that?
The quick answer is yes, it is, but the slightly longer answer is it doesn't actually have a huge amount of an effect, because the egg, as I mentioned, is the largest cell in the human body, whereas sperm is literally a tightly packaged bundle of DNA with a tail attached to it. So the egg quality is much, much, much more important than the quality of the sperm. So to put it the other way round, a good egg will heal a poor sperm, but poor sperm doesn't really make a huge amount of difference to the egg. So small impact, but not very much.
I just want to mention to our speakers, because I know Ruth has another appointment at 2, so she will have to leave us, that we can stay on for a few more moments to answer some further questions if the other panelists are happy to remain with me, or I'll remain on my own with the wellbeing team. But I'd like to just share with everybody, to all our panelists, how many enthusiastic responses we've had on the chat and the question and answers, thanking you all for the quality of the content of your presentations, saying how interesting it is, and also a plea for contact details to get hold of people like Lord Bethel. So on behalf of the wellbeing team, I will assure that everyone who's registered for this event will get not just a copy of answers to the questions that have been posed, but all of those contact details and useful websites where you might be able to get other information. The other question that I wanted to pose here, there are lots of questions, very, very clinical questions, and lots of questions about medical issues, which we will try to address for you. But remember, this is about social freezing, not for medical indications. And one or several questions have come up. Is there a way to know which clinics are better than others? Now, I would immediately say, almost every day of my working week, I suggest someone goes onto the HFEA website. That's not just because I sat on the HFEA for 5 years, but because I remain very, very impressed by the quality of the patient information they provide. And it's not just giving you statistics, it's taking you through, as a woman or a man for that matter, what happens and how you interpret the information that's being given to you. But Sally, what would you say is the best way for the person who comes to your website to look for data? How do they know which clinics are better than others?
They need to search for clinics which do egg freezing, first of all. Lisa and I have both mentioned that you should go to a clinic that's experienced at social egg freezing, if there is one near to you. Clearly that's a problem if you don't live in London. I think the most important thing is that clinics are very good at taking selective data, often for women under 35 who are very successful. And what you need to do is have an honest conversation with your clinician about what the chances are for you, given your ovarian reserve, given your personal circumstances, given your age, and try to work out what this means for you if you're not a under 35, potentially collecting 20 eggs. And it's dangerous for clinics to err on the positive side. I'd just be aware of that and trying to use those independent statistics that exist. We will be updating our egg freezing report in due course because it's time we updated it. So look out for that too. Thank you.
Thank you very much. And to all of our audience, if you look on the chat, you'll see that Ruth Deech, before she disappeared off to her next Zoom meeting, has sent you some details about who to write to the Department of Health. And all you have to do is find out the name of your MP and put on the envelope House of Commons or Houses of Westminster, House of Commons, and it will get there. I think that's it really brings us to the end. There's a couple of quick clinical questions that I might just put to our Sally and to Lisa. Possibly this one to Lisa. If you have an IUD in place, does that need to be removed before the fertility test and the procedure itself? Lisa?
No, not if it's a copper coil. Yes, it's a bit more complicated if it's a progesterone one, the Marina.
So you've no need to expose yourself to any risks, so to speak. You can go and have your egg freezing done, but please note it's not an insurance policy. And there's another question about, is it a myth that taking the contraceptive pill long term can affect your fertility? Lisa?
No, it does not affect your fertility, so it doesn't save any eggs. And by the same token, going through fertility treatment does not use up any eggs. And there was a related question, somebody asked, sorry, I forget the name, whether the temporary menopause that Sophia mentioned gets reversed. Yes, it does get reversed. It's only whilst taking that medication.
And that leads me into another question that I picked up a little bit earlier. And that was, does going through egg freezing mean that you're going to have an earlier menopause? And a lot of women have asked me this in clinics.
No, it does not.
Good. So that was very nice because there was immediate response of no, and Sophia shaking her head, and so was Sally vigorously. Okay. I think that brings us to the end of our session. We're way over, well, nearly 5 minutes over now. Can I thank all of our panelists again for being so clear and concise and so generous with their time, and the preparation that's gone into this has been considerable. Thank you to the audience for all of your interest. There have been so many appreciative comments sent up here, either directly to me or to everybody on the session. So thank you for your enthusiasm and being so helpful. We will ask the panelists to allow us to circulate the slides. As I say, if you registered for the event and we've got an address for you, an electronic address, we will undertake to send you those presentations and also to address any of the specific questions. And we'll send all of the registered attendees a copy of those. Please make sure that you write those letters to prolong the egg storage bill, if you possibly can. And please tell more and more people about Wellbeing of Women, which is the only charity that funds every aspect of women's health. With that, I think I'm going to draw the session to a close. Thank you again to all of our speakers, to Sophia Money Coutts, to Lisa Webber, Sally Cheshire and Ruth Deech. And lastly but not least, thank you to the team at Wellbeing of Women who've done so well to allow us all to connect like this electronically. So thank you, have a lovely rest of your day, and thank you for supporting us. Bye-bye.
Thank you.